Hello again, news from the Lapidus Clinic. You can ask me what else did I train myself in? Well, a couple local doctors who I used to refer my patients for pellets therapy retired, and I felt obligated to take upon that procedure. Pellet therapy for hormonal replacement and pellet therapy for weight loss. So recently I took a lot of educational classes online, and then I met and trained with inventor of Pellecome injection device, Dr. Jacome in Indian Wells in California. So I spent a whole day with the doctor. I got familiar with the device. I think it's superior to all the trocars which are available in the market. It's FDA approved device as 2020, and I feel very comfortable that we can start doing pellet replacement therapy here in the clinic. So what is a pellet replacement, and why the hormonal therapy is so important for our health? As we age, hormones start to decline, and that can lead to mental slowdown. It can lead to depression, skin changes, heart disease develop. All of that can be helped with correct, knowledgeable hormonal replacement therapy. You know my background, I'm a gynecologist. I spent my young years training into infertility treatment, so I know hormones very well. And I know that some of us respond well to creams, some of us respond well to injections, and sometimes you can be one of those patients who do not tolerate that therapy as well. That's why pellet therapy was developed. It actually was developed about 40 years ago, and pioneer of that therapy actually was a doctor in Palm Desert. That's who Dr. Jacome trained with. And he is like me. He always wants to find a new exciting stuff, and he was not happy with the device. So he invented a very elegant, very simple device which allowed me to put pellets of little hormonal tubes, slow release hormonal pellets right under your skin in a subcutaneous fatty tissue where it's not visible. There's no sign of insertion because a little tiny scar which we're gonna create to allow those pellets to go in, gonna heal in a matter of couple of days, and you won't have any sign of it. And those pellets, they made out of natural Mexican yam, so they're completely bioidentical and organic. There's no chemical hazardous elements to that, and they slowly absorb. You probably need to repeat the procedure in 3-4 months, depends on how fast you metabolize those hormones. But it's exciting for some of us who have a very busy lifestyle, and sometimes we forget. And then what happens with menopause? You know what happens. You wake up in the middle of the night with hot flushes, and you cannot sleep, and you feel tired and horrible in the morning. Who wants that? None of us want that. And who experience that and know it? Oh my goodness, of course we want the best health, but we also want that hormonal therapy to be very safe. So what do we do to provide safety here at the Lapidus Clinic? We test for the levels of the hormones. We allow all the screening procedures which are safe and informative to make sure before we even start hormonal therapy, you don't have any risk of developing cancers on that therapy. We make sure the levels stay safe and we don't overdo it. We have multiple levels of testing of blood, your saliva. We do dry urine Dutch test, which allow me to see all the metabolites which can be harmful, and we know how this nutraceutical and lifestyle eliminate that risk. But once again, this is another layer of knowledge and technical proficiency which I brought in the clinic just this month. So we're doing pellet therapy, and if you're looking for a provider who care about you and know how to do it safely, here we are. Me, Dr. Lapidus